Okay, I think we are all set to go. So, yeah, if you can just screen share and you can start whenever you're ready.
Okay. So this is a privately recorded?
Yes, it's recorded by, well, I'm recording it right now, and we're gonna post it on our YouTube page. Is that okay?
Oh, it's not live. I thought it was live. So there's not going to
No.
be questions, is what you're saying.
No, there are people here, and if they want to ask questions, they could. Yeah.
Okay. All right. All right. Well, hey everyone. My name is Jeremy. I'm almost a third year resident now out in Long Island, New York. I'm studying a dual board specialty called Med Peds. So it's internal medicine and pediatrics. So typically those are studied individually, but I had an interest in kind of continuity of care. So I went into that field. I'm originally from California. I grew up in the southern part, and I went to school down there as well at the University of California, Irvine. And after I went to Irvine, I took a year off. I was teaching and doing some tutoring for a bit. Retook my MCATs, and then I went off and I applied for school. So I applied to USMD, USDO, and to international programs, which I recommend everyone apply to all three, unless you're like a pro and you've got like a 4.0. And yeah, so I eventually heard back from this one program in Israel pretty quickly, who said instead of waiting a year, I could just come next month and do this program in Israel. And I looked at their match rates; it was pretty good, and like a low, dropout rate and kick out rate and all that. So I decided to go. So that school was called the Sackler School of Medicine, and that's at Tel Aviv University in Israel. So I did 4 years there. 2 years preclinical in the classroom, and then another 2 years were in the hospital clinical studies. So 1 year was essentially done in the local hospitals in Tel Aviv, and then the last year was mostly conducted in the States. So I organized my rotations, got familiar with the U.S. medical system a little better, which is roughly the same. It's also we follow the same medical kind of guidelines in the country as well. So that was awesome. I had a really good time, and eventually I decided I wanted to do family medicine. So I started applying for family medicine. I liked adults, I liked kids. It made sense to me. And then I heard about Med Peds. So Med Peds is kind of like family medicine, but it's more inpatient. It's more in the hospital. You get more critical care, more ICU training, and you get more training with pediatrics. So I think family medicine typically only gets like 6 months of pediatrics. Working in Med Peds, I'm going to have a lot more confidence seeing pediatric patients because I get a full 2 years of that. So the way my system kind of works out is every 3 months I go back and forth between adult medicine and then pediatrics and vice versa. It's a lot of fun. I really enjoy it. It's very tiring because it's a lot of inpatient work because we're squishing 6 years of residency into 4. So it's kind of like an accelerated program. But ultimately, it's a lot of fun. It's really draining your first year because there's a big learning curve. You're compared to your peers who are just studying internal medicine and pediatrics. So it can be really stressful at times, but ultimately after the first year or so, you kind of get the swing of things and realize there's a lot of similarities in practicing medicine, no matter what age you're dealing with. So I do that. I'm doing some research right now as well in asthma and its relation to COVID-19 in kids, and then I'm working on potentially a pilot study in the near future with adults. Not everyone does research in residency. And then lastly, I have a dog, Zeus, who's sitting right next to me now, and we have fun on my 1 day off a week, maybe 2 if I'm lucky. And that's pretty much the whole deal. I don't know if there were specific questions that any of you had. I do have a nice presentation. Oh, Tracy Rangel wants to see him. All right, Tracy, I'll show you Zeus. Here we go. Here's Zeus. Oh, there he is. Can you see him? We had a long day. We went to the winery with some friends today, so he was in the sun. He's tired. So that's Zeus. He's an 8-year-old American bull, 100 pounds of muscle, and a little fat now because we lounge a little bit too much, and I feed him all the food I eat. But he's a good boy. So what's really nice about residency is you finally get paid. You do have a lot of money in loans. I have about $300,000 plus in loans, which is a lot of money. If you were to go to other regions, it could be up to $400,000 or $500,000. If you go to other regions, it could be as low as, $200,000. So that's always something to keep in mind. All right, so let me share my screen here. We'll take a look at this PowerPoint. All right, can you guys see it? Did my face go? Oh, this is different. Okay, let me see here. You guys can only see the PowerPoint, right?
Well, everybody has their own option, so we can see the PowerPoint only if we wanted to, but we can also see your face.
Oh, I was just talking about the rest of my screen.
Oh, I'm sorry. Yeah, no, we can only see the top part of it where it says PowerPoint slideshow, introduce shadowing slides.
Oh, interesting. I don't even know why that's there. Okay. I don't know why that's there. But anyways, so I think I talked about this already. There's a picture of Zeus. So where I grew up, can you guys see my mouse?
Yes.
Nice. So I grew up, as I told you, in Southern California. I told you I went to college, UC Irvine. Talked about my residency program. So my residency program is essentially 4 years here at Stony Brook University Hospital. It's like a 650 bed place. You do rotations in anything down from NICU, neonatal ICU, where the babies are born and are very sick and they need help, all the way up to adults who are dying in the ICU on their deathbeds, right? So what's really cool about med peds and family medicine is, as you can see, that kind of depth of your patients, or rather your diversity of patients. So I'm a type 1 diabetic, and I've been so for 16 or 17 years. So my pancreas is essentially broken, and it doesn't create a hormone called insulin, which manages sugar in your blood. So I've had to inject myself with insulin for years, and now we have pumps and continuous glucose monitors, which are really cool, high-tech stuff. I hear the new Apple Watch is coming out with a transcutaneous monitor. It can read your blood glucose through your skin, which is very cool, but we're not there yet. So mostly I've been poking and prodding myself my whole life to get answers and to fix myself and seeing doctors. So I've been in and out of the medical system for a very large part of my life. But I really enjoy the doctors I work with, and I think I understand that kind of patient perspective. So ultimately, that's why I went into medicine. And I try to be as down to earth as possible with my patients and kind of keep that barrier gone. I want to keep a really open space between myself and my patients because I know how hard it can be, and you want to have a safe space for them to tell you everything so that you can give them the best care, right? So 2 websites I want everyone to learn about. So if you're a high school student, or if you're an early on college student and you don't know everything about medicine, you don't know what you want to go into, but you're thinking, maybe I want to be a doctor, maybe I want to be a PA, maybe I want to be an NP. This lecture doesn't have to be just for being a doctor, right? What's really cool about med peds is I work with all these different figures. So you guys can all add me, on Instagram. By the way, it's Jeremy Grossman _ and ask me, specific questions if you have them, or if I don't answer them today, because I know there's not really a Q&A. But if you want a good basic learning about kind of the field of medicine, check out these 2 fields: med peds, which is NAMPRA, NMPRA, and AAFP, American Association of Family Medicine. The top one is National Med Peds Residents Association. There's a lot of great content. You can learn about each of the fields, and you can just learn about medicine in general. It's a great place to start, right? So this is really the basics, or rather the basis of medicine. Pediatrics and internal medicine are the basis of medicine, right? Everything kind of builds up on that, right? If somebody comes into the hospital as a pediatrician or as an internist, I'm going to see the patient usually, right, after the ER doctor sees them. And I'm going to be taking care of them while they're in the hospital and deciding, am I going to consult a cardiologist? Am I going to consult a gastroenterologist? Am I going to call the surgeons? Am I going to call blah, 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 right? So I'm really the one who's controlling most of the care, which I loved. I loved taking over that aspect of my patient's care and making sure that they were going to get the best care possible. And so I try to do that the best I can. And when I don't know what to do, I always say, I don't know what to do. And that's okay when you don't know. An important part about being a good doctor is understanding that there's so much medicine out there in the world, and there's so much to learn, and medicine's always changing. There's new research coming out. So knowing what your boundaries are. So being a hospitalist or being someone who handles inpatient medicine patients on pediatrics or internal medicine, you've really got to know what you know and know what you don't know so that you can get the best help for your patients, right? Now, if this patient were to be picked up by a general surgeon, they might know a lot as well, but they might know a lot more about cutting than they do about kind of dealing with a patient's kidney injury or dealing with their liver injury or dealing with their pneumonia, right? So it's very attending dependent. So ultimately, you want someone who's got a whole good idea of the body, kind of a jack of all trades, to take care of the patients that come in and then coordinate care if there's specific problems that come up. So anyways, this is a great intro, as I said, to that field and to the field of medicine in general, because it encompasses so many different subjects in medicine. If you're looking for shadowing opportunities, from personal experience, I don't recommend doing organized like hospitals shadowing where they have big programs where volunteers come in, because ultimately you're like a towel rat or you're a water rat. You're just bringing in water to the patients or tap. You're not really doing much clinically. You're just kind of there and you wear your little uniform. It's terrible. What you should really do is go on Google, type in, let's say you want to see a family doctor, family medicine near me, family medical doctor near me. Call their office, say, hey, my name's Bobby. Hey, my name's Jane. I want to see, hey, my name's Abigail, Vika, Tina, or Michelle. Hey, I want to see the doctor because I want to know if I can shadow him. I would love to have that opportunity. I'm interested in medicine. And a lot of times they say, yeah, family doctors are really nice. Pediatricians are really nice as well. Internists are nice. But just reach out and email. And you'll probably email 10 or 20, and one of them, maybe two of them will say, yeah, sure, come on in. So you have to really cast a wide net out to do that. So I really recommend family doctors and med peds doctors, or meds or peds doctors. So a little bit more about med peds in specifics, right? So I kind of told you the difference between family medicine and pediatrics is, peds or rather family doctors, they see mostly adults, they see mostly in a clinic. The patients aren't really necessarily sick and acutely need care or hospitalization. They're usually fine. Now, the family doctors get that hospital education, yeah, but not to the same level that a med peds doc will, or the same level that an internist or a pediatrician will. We have a lot more time in the wards, right? Whereas they have a lot more time in the clinics. So I would rather say, if you're choosing between a med peds and a family doc, I would almost say sometimes go to a family doc outpatient, because they're going to know outpatient medicine a lot more, maybe a little bit more tricks than I do, because I spend all of my time in the hospital, right? So there's a lot of specialties in medicine, and there's a lot of niches, and everyone knows kind of their place, and everyone is important knowing their place. No one's better than the other. A lot of doctors think that they're better than the other doctor because of their specialty, but ultimately they're not. Everyone needs everyone to survive. So med peds, as I said, every 3 months we switch between adults and kids. So when I first started residency out of med school, I started working with kids for 3 months, and I did inpatient general medicine. I did newborn medicine, newborn babies after they've just been delivered, giving guidance to moms. I did some ER, some pediatric ER. So whether that's suturing up wounds or helping fix broken bones, or diagnosing someone and saying, hey, they need to come upstairs into the hospital, or send them home and tell them to, just take care of themselves and drink fluids, et cetera, right? So your ED is kind of that nonstop or one-stop shop for where you go, either home, in the hospital, and where in the hospital. It's like those doors you walk in, right? So again, as I said, every 3 months I switch back and forth. So some other shifts that I do on the medicine side, I do adult wards, I do ICUs, I do cardiac ICUs, neonatal ICUs, medical ICUs, some places do surgical ICUs, pulmonology, gastroenterology, cardiology. I mean, the list goes on. You do everything and you see everything. And what's really cool is you can now specialize into all the fields that pediatrics and internal medicine give you, which is really something special. Now, do I recommend med peds to everyone? No. I mean, if you really think you could be happy dealing with one at a time, I would recommend you just choose one. There's a lot more programs to choose as well. It'll make your life a lot easier and less competitive when you're applying. But in any case, it's a lot of fun. And ultimately, after residency, you're dealing with adults and kids all day, every day. There's no going back and forth, right? It's all all at one time that you're seeing these patients. And what's cool is you can deal with, a patient's family. So you can see in this chart, I can see any of these, from a newborn baby to an elderly person, any age, any disease, I learn to manage. And when I don't know, I ask for help. So here's kind of a timeline of your medical education. A lot of people know this, but a lot of people don't. So you have to start out with college, right? You go to college first. And that should be about 4 years, unless you're a smarty pants and you do it in 3 years. Some people can do a combined bachelor's and medical degree in 6 years, a BSMD program. You got to really be a whiz of some kind. So I don't expect that that's most people that are online today, but that's certainly an option. So after your 4 years, during your 4 years, you should pick a specialty that you really enjoy. And then make sure that either within that specialty, within that subject, you're doing your medical school prerequisites, or you're doing them on top of that, right? So I was choosing between biology and psychology. And ultimately, I couldn't choose, so I did both. For whatever reason, I just could not choose for the life of me. And I didn't know if I was going to be a therapist or if I was going to be a physician. And ultimately, I decided I might as well just get both. There's some cross connections between the two, some classes that overlap. So some cognitive psychology classes count as biology classes. So I was able to cut down some of my courses if I were to do a full double major, right? But I was working studying and going to class every summer. I didn't have time off while I was in school because I was doing that. So do I recommend you get a double major like I'm doing for everything I do? No, I'm just indecisive. It probably hurt my GPA some degree, right? It's not necessarily smart to do a double major. So do what you love, make sure you do those prerequisites. But honestly, if it came down to it, if there was a person who did, let's say, a social science degree with a prerequisites in medicine or prerequisites pre-med, and then a bio major, which includes your prereqs, right, for medical school, and you both had 3.7s, which student would I take more? Probably the bio one, right? Because they really worked a lot harder for that 3.7. I know that they're committed. I know that they can handle the coursework. So when you're choosing a major, keep that in mind. Nonetheless, I've seen a lot of people even do completely different career paths. So when they're like 30, decide they want to go to medical school. And then they go back to college and they take those prerequisites. So that's certainly a possibility as well. There's no direct, straight way to do it. There's just ways that have more statistically sound ways to get into medical school. All right, so we talked about undergrad. Now, after undergrad, I took a year off. I wanted to get the best grade possible on the MCAT, so I actually took it my first round. I got an okay grade, and then wasn't the best, and then decided I wanted to take it again to see if I could do better. But that was right when they changed the MCAT. So I took the old one and then the new one. So it went from 3 hours to 7 hours now, something crazy. So that was pretty tough, but you can say thanks because I set your bars nice and low so you guys are getting good grades on those tests. That was a joke. So when you take that exam, I recommend you not mess around and just take that willy-nilly. I've got some free time here. Do it when you've studied enough for it. Make sure that you're getting good grades. And I would recommend you take a course. I took Kaplan. I think there's Berkeley Review and Princeton Review. All those classes are all going to be the same. Just find a really good method. All you really need are 2 things, maybe 3. 1, you need a main book, okay? A main MCAT book or set of books, right? 2, you need a question bank. And then 3, you can have another resource if you really want it, but ultimately you really only need 2 things to get, because if you're going to spread all your thought and time over multiple books, you're going to lose sight of the main kind of theme of each book, of the main book that's going to teach you everything anyway. So stick with 1 book at a time. That's what I recommend. And then, have a question bank. So I took my time off and did that and did some tutoring as well, caught up on some of my research. And then I applied to school. I told you I got into this cool school in Israel, which was a blast, a lot of fun. I recommend everyone apply to, again, USMD, USDO, and international, okay? And if you want to talk about that specifically with me, why you do or don't want to do that, again, I'm going to keep telling you guys because I keep my Instagram page open for everyone. I answer all requests, Jeremy Grossman _. Okay. Please message me privately for questions. Like, this is why I do these things. Nobody was there to help me during my time. So I want to make sure I'm there for you guys. So that's why I'm doing all of these sorts of talks and I have this program. Okay. And it's all free. I'm doing it volunteer and I'm happy to do it. So again, you're applying to all three of those. And if you think you're too good for IMG or DO, then I really don't want you in my field because it's not about prestige. It's about taking care of patients and being the best person you can be and being the best doctor you can be. And I've met much better doctors, or some of the doctors I've met have been much better than the ones in the US or the USMD programs, okay? It's not dependent on that. A lot of us develop later and emotionally and socially mature later on. And we can be better doctors than, you know, some of the people who are the smarty pants that just went straight through and got their USMDs and now they're like 26 and they're a doctor, right? All right, good. So we go to medical school. I said the first 2 years are preclinical. You guys can see on the timeline there. So that's all in the classroom. Some schools are now initiating a little earlier on, halfway through your second year. They're starting you in the hospitals, working alongside the residents and the doctors and learning hands-on. And then again, your last 2 years, you kind of continue that, your core clinicals, and then you do your last year, kind of your electives of what you guys want to do specifically. So if you're interested in cardiology, maybe you'll go shadow a cardiologist. Okay. And then after that, you apply to residency. And I think I forgot to mention that during that time through medical school, you're taking two big tests, the USMLE Step 1 and the USMLE Step 2. You're lucky they just took out the Step 2 CS. I don't know why they had that in for so long, but again, I missed the cut by a year and I had to take it. Great. So you guys only have those two tests and one of them is now pass, no pass. So you got it pretty good now. Once you're in medical school, you're pretty much good to go. You just behave. Don't be naughty and misbehave in med school and get lazy, right? You should be studying every day. Get used to studying all the time and get used to loving it. I love studying. On my days off, I sit outside and I do questions for fun because I like it. I enjoy it. This is a long career, right? If we break it down, okay, I'll break it down in a second. So you take those two tests and then you enter the match process, which places you into a certain spot, right? So they're all over the country, hundreds and hundreds, probably thousands actually, of different residency positions. And then ultimately you get matched by the algorithm and you go to residency anywhere from 3 to 7 years. So a pediatrics residency, internal medicine, general medicine residencies are 3 years. And the more specialized you go, the longer they go, right? So, you know, gen surgery is 5 years. I think neurosurgery is like 6 years or 7 years. I don't know exactly. But the more specialized you go, the more specialized you go. And then if you want to specialize on top of that and do a fellowship, that's another 3 years, right? So I'm interested in pulmonary critical care, another double after what I'm doing, another double. So let's break it down now. 4 years of undergrad, 1, 2, 3, 4, okay? 4 years of medical school, 1, 2, 3, 4. 4 years of residency for me, 1, 2, 3, 4. And then 3 years of Pulm Crit Fellowship, 1, 2, 3. That's 15 years. Plus I took a year off, 16 years after high school. I'll be a full-blown doctor, right? But I don't want that to scare you because ultimately the entire time that you're going to be doing what you're doing, you're going to be acting like a doctor. You're going to be living that life. You're going to be making an impact on patients' lives, right? So it's not like you have to wait 16 years to make a difference. You're doing it now. I really would say when you start residency, that's when you really feel like you're making a difference. So 4 years undergrad, 4 years of medical school, and then you start to really make a difference. Now, that doesn't mean you can't make a difference in people's lives doing other things. I created something in Tel Aviv called the Homeless Project Israel, which Tel Aviv, which is has now become a very large group since I've left, and basically goes out, feeds the homeless, gives them water, and gives them resources on where to find shelter. We also collect survey data and give to the local government to kind of best address the issue of homelessness, right? There's a lot of refugees there as well. So it's very important that you do something before you enter medical school. If you're just waiting to be a doctor and make a difference. Why are you entering the field? That's like 8, 12 years. Like, what are you doing? If you want to go make money, you want prestige, go into business, go do something else, right? There's so much work here. Start making a difference now. And not to mention, guys, the biggest thing is it looks great on your applications for anything, medical school, residency, college. You got to do volunteer hours, right? It only has to be a few hours a week or even a few hours a month, just something consistent. If it happens for 6 months to a year, I think that looks good. Even if it was like once a week or once a month, okay? And that could be anything. Message me privately for ideas about volunteering. I've got a lot of them, and they're super easy, and you can institute and establish volunteer opportunities. And it looks really good on your applications, right? Jeremy Grossman _ reach out to me for questions. Okay, so a day in the life of what I do. So pretty much I wake up at 5 a.m., I walk Zeus, I feed Zeus, I shower, go to the bathroom, brush my teeth, whatever, have breakfast, have a coffee. Then I drive to the hospital. I get there about 7 a.m. At 7 a.m., I go to the night doctor who covered my patients overnight. And the night doctor says, okay, well, here are your 15 patients that you gave to me in the morning before you left, or you gave to me in the evening. Mr. Johnson had a heart attack. He went to the cardiology unit. Mr. Thompson had a stroke, so he went to the neuro unit. We got 2 new patients from the ER. One has pneumonia, one has an asthma attack. We've got Mr. Bobby had some pain in his arm, so I gave him a Tylenol, blah, 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 blah. Gives you all the sign out, you get the sign out. Then you go see your patients. You do physical exams, you talk to them, you wake them up, you see how they're doing, and you write your notes to figure out what the plan is going to be for the day. You order your labs, you order your imaging, you order any medications, and then you go talk to the social worker. And the social worker is very important, who's there to make your life and the patient's life easier. So if I have a patient who has a new stroke and is now almost paralyzed, let's say he can barely walk, how is he going to go back home and live by himself? He can't. So what we have to do is find a new placement for him, whether that's a rehab center, whether that's a nursing home, whether that's assisted living, whether that's with his family, whatever it is, we need to figure out a way to get him some help. So the social worker is there, deals with insurance. They do a little bit of counseling with the patients, talking to them about what they want out of their life. And then they figure out a plan of where to send them. And once they give us the green light and the patient's stable from a medical perspective, we send them home. That's in the morning. Then the attending physician, the head doctor, comes around and we present to him our plans after we saw the patients. We say, we want this to happen with Mr. Johnson, this to happen with Mr. Bobby. And he'll say, well, I like your idea for Mr. Johnson, but for Mr. Bobby, let's do this instead. And for Mrs. Kankles, we'll do this instead. So that pretty much happens for all the patients. We round and we look at all the patients together. We do some teaching, we talk about research. Then at 12, we have lunch. And then in the afternoon, until we leave at around 7 o'clock at night, we respond to emergencies. We put in new orders. We discharge patients. We admit new patients from the ER. It's a lot of fun. It's a whole hullabaloo of fun. So after that, the night guy comes, the night doctor, and I sign out my patients to him, and we do it all over again. And that happens while we're on the inpatient unit. When you're on an outpatient unit, or rather when you're in just clinic, you just kind of go in at 8, you see a patient every 15, 20 minutes, do what you got to do for them, and then you go home at 5. And that's 5 days a week. The inpatient life is 7 days a week if you're a hospitalist, or 6 days a week. So 7 days on, 7 days off. So it's kind of nice. You get a vacation every other week. Any questions so far from the current people that I have? The council of the marvels. Nothing from Tina, Vika, and Abigail, who have no faces. They are hiding. Michelle's the only one showing their face. Are they going to come out of hiding? Let's see. Who fell asleep?
Would you say that you have a pretty good work-life balance?
I think I do. Do I think most people do? Yeah, I think you do. I think intern year is very difficult because you're working a lot, 14 hours a day, 6-7 days a week. But after that, your life slows down. You get the hang of feeling tired all the time, and you learn how to live with it, and you learn how to adjust your sleep cycle and figure out what is important to you, right? all my friends, they always go on vacations when they have time off. I have a dog, but so I really can't do that as often. But I have a dog with me all the time, so I'm really on vacation with my Bubba, all the time. So it's a win-win for me. So you have to make priorities, and this goes for medical school. This goes for undergrad. This goes for everything. Okay. All right. Any other questions? Tracy, thanks for hearing your voice and not showing your face. I appreciate that. I'm gonna keep calling you guys out till you show me your faces. Vika.
What do you feel like was your biggest challenge, like anywhere throughout your medical journey?
Good question. My biggest challenge. There's a lot of times when you're gonna be working your butt off as hard as you can, and you're just not gonna get the grade that you want. You're gonna go, holy crap, Tracy! Wow, yeah, Tracy, showing her face. So, Abigail and Vika, you guys are next. I'm watching you. I'm watching your screens. So basically, it's very difficult to keep pushing on sometimes, because if you keep getting smacked in the face by grades, or people telling you can't be a doctor, or people that are kind of your colleagues doing better than you, and you're just like, crap, I'm like, how am I going to be a doctor? What you have to realize is one mistake's not going to screw you up entirely. There's no way. And I can talk to you about my mistakes privately. I won't say it on a big chat here. But if you want to know about my mistakes personally, I can tell you about them. And two, if you don't do so well in college, you can go to do a post-bac, you can go get a master's and get better grades, or you can go to the Caribbean where it takes less GPA and try it out there. Or go another international school, right? Or go some DO schools, or have a little bit more lenient on their grades and look at you more holistically, right? So I've had some really difficult moments where I thought I was going to quit. And that's why, like, ultimately I was like choosing between therapy school, right? Because I was like, crap, I'm doing so terribly right now. I think I should just be a therapist at this point. Like, I still enjoy it, but like, I'm just not getting the grades that I want, right? So ultimately, it worked out for me. I went international to a very special school that's kind of a hybrid US international school that's kind of got an in back into New York State, which is why I'm here. And a lot of Caribbean people end up here as well. I think if you work hard and you can get good enough grades when you work hard, I think a Caribbean's a great option, especially the top schools like St. George, AUC, and Ross. I think those are all great schools. I met great doctors from there. And AUA, I know a doctor as well. And a lot of times those doctors have the best bedside manner. Why is that? Because those people probably didn't get the best grades because they were a little bit more social. They were going out, enjoying their lives a bit more. And they learned how to be kind of a human and interact with another person, right? A lot of people who are just kind of book nerds in their books, very intelligent people, they really miss out on that other aspect of life. That's the human connection, right? I mean, we put so much stress, 99% of getting to medical school is grades, really, right? Or just checking off volunteering, MCAT, whatever, right? Work experience, whatever it is. But once you get to being a doctor, that doesn't really matter so much anymore, because everyone's on the same playing field as you. Everyone's on the same level. They all know basic medicine, or they all know where to get the answers, right? There's emergencies in medicine, but you usually have time. It's not like Grey's Anatomy where you have 3 seconds to make a decision, or like that's the end of it. Ultimately, even in a lot of emergencies where I have patients who are like suffocating, I could put them on a specialized mask for 20 minutes before I decide to intubate them, right? So if I need an answer for something specific, I can go look it up, or I can go say, hey, please, will you go look this up? Or hey, will you go look this up, right? We're all a team and we're all working together. And there are so many nurses that are so much smarter than me and knew so much more when I came in after I graduated medical school. And you have to trust them. And you should trust them because they've been in the field for a long time. They know what they've seen and they can teach you a lot. So I'm going off your main question. But essentially, those have been my toughest spots. Specifically, I had a professor who was not helpful to me, and I was trying to get a good grade in this course. And every time I emailed, it just was not helpful. And at one point, was never seeing me, never agreed to see me. And I decided to report me for bugging her, essentially, sending too many emails. So There's people that are going to get in your way or that don't necessarily understand what your intentions are, right? So if your intentions are to get a good grade, do everything you can to get that good grade. But don't get the teacher to report on it. That's bad, right? All right, any more questions from you guys? If not, I guess I can keep going. We're at 35 minutes. Count it down.
Would there be
what?
Would there be anything that you would suggest as a high schooler to be prepared for college? If you're planning to go down the
There's
medical.
a lot of people here. Oh, I didn't even see all these names. Wow. All right, Bethlehem, cool name. Elani, Probleen, Marisa, Kelly, and Tina. So that was Tina that just talked?
Yes.
So you said, would there be anything like volunteer?
In general, is there anything that you would suggest to do as a high schooler if you plan to go down the medical track?
No. You don't have to do anything as a high schooler. Just get good grades. That's literally it. If you have an interest and you want to like do medical stuff, heck yeah. Go shadow if you want, but you don't need to. Hands down, no. Live your life. You know what I mean? There's really more to life. Cause like, get it. Once you like finish and you're like me and you've dedicated like everything to medicine and then you have like a day off, you're like, what do I do with my free time? You know what I mean? It's so important to have other hobbies and things in your life to do. So cultivate those things. I used to play guitar and sing at my religious school. For 15 years, I did that. So that looked good, right, on my application. But I wasn't really doing it for my application. I was doing it, one, for money, and two, I think mostly for money. Those are my two big things I was doing because they were paying really good. So in high school now, in college, the big ones are grades is number one. And we'll go in order. Grades is number one. Volunteer research is number 2, 3. And those two are kind of in the same spot. I would say if you do a lot of volunteering and you have a leadership position, it looks good. Like I would assume all you guys are volunteers. I'm not sure. But that looks really good. And then research looks great, right? Do you have to publish? No, but any research is important. So research being, I worked in like psychology research with autism, which is, a medical disorder, but it's more like a psychological disorder. But it implicates the scientific method. It utilizes the scientific method. So it looked like research. I did present a poster at a place, so it was good. It looked like I had done something. So research is really important. Also, your sanity is important. I'll try to move that up to 1. 1 is sanity. So if you want to join a fraternity, if you want to join the rowing club, if you want to join the jiu-jitsu club, if you like to just go out on the weekends and go crazy, like if that's what you want to do, that's fine. But that's really important as well. And you have to do that because there's going to be moments where you're like, I can't do this. This is insane. Having a support group is very important. If you don't have a support group, you can reach out to me. And I'm sure a lot of these people here on Medical Marvels you can reach out to. But if you're ever feeling in a space where you can't handle what you're doing and you're thinking of even so much as harming yourself, reach out. For those of you, I'll just like make a little thing. I don't work for this company. It's called betterhelp.com. And it's a place where you can like video chat a therapist at any moment, anytime. And it's like free for the first few rounds. So that's really important when you're feeling down. I've definitely used it before and I've had down days, so I recommend it to everybody. More questions and more faces. I need to see faces. Come on, guys. I need to see your faces.
I have another question about your.
Tracy's gonna save you. Tracy's saving you guys.
You mentioned earlier that you had diabetes, so you've like been on like both sides, like treating a patient and being a patient. And so how's like that experience been? Also, the price of insulin, how does that affect you, I guess, or how do you feel it affects other patients?
Yeah, so I work at a federally qualified healthcare center. So I unfortunately don't work with like how patients get or pay for certain things. There are certain insulins that are a lot cheaper. They don't work as well necessarily, but if you use them a certain way, they can work as well. But yeah, I mean, insulin prices did climb. I haven't heard much about it in the news lately, but there are some brands that are cheaper. And You know, sometimes you have to get people emergency, healthcare to try to help them curb the cost. There's a lot of great like coupon pharmacy type things that are coming out that have come out, like our Good RX, for example, where you can kind of get these like coupons. So if you guys have, family members or know about family members who are struggling with paying for things, Good RX is one. There's a lot of coupon type Medicare type plans for people. If you're also below a certain yearly salary line income level, you qualify for Medicaid. And then if you're a certain age level, you qualify for Medicare. If you're in California, you can qualify for Medi-Cal. There's a lot of different programs that you can get into. And knowing those programs is the most like vital and important thing that you can do for your patients. Because ultimately they're not going to know about these different programs to get them the best prices possible. And then living with diabetes was your next question. What's it like?
Yeah, just experiencing both sides of like being a patient and being like receiving patients and being a doctor.
Yeah. I had great doctors. I had one NP who was taking care of me for a while, who I literally asked her for, this is just a story. I asked her to write me a letter for on my MCAT, if my blood sugar goes low, and I need to take care of myself medically, can you please, excuse him from the test to get himself together to fix his blood sugar. And she said, no, because you shouldn't have bad blood sugar during your test. You should make it perfect. And I was like, what? What do you mean I should make it perfect? I'm going to try. And if it doesn't work, I'm going to fix it. I don't know what to tell you. So I said, go after yourself. I'm going to go see another doctor. This is incredible. So that was a really bad patient experience that I had. I don't believe in writing BS notes for patients. I don't think that's appropriate. If patients are suffering and they're not suffering anymore, but I can tell that they need a day off or an extra day off. If my pen slips and I write an extra day, then that's fine. That's not the end of the world, because mental health is a really important thing too, right? But yeah, there's mostly I had a good patient experience as a patient. But things that I kind of learned on the other side is that, if there's a long wait, it's not really the fault of the doctor. It's typically because they've been overscheduled and the doctor's trying to take a good enough amount of time to handle each patient's needs. Because usually if I come in to see the doctor for a runny nose, I'm also going to say, well, my back hurts as well. And, I got this mole on my back, whatever. So there's always going to be more things that come up. And as a good doctor, you have to address those things. And you can't just be like, oh, I'll come back next week, right? Because that's more out of their pocket to pay for a visit. So I think I learned the value of time as a doctor and the value of waiting and not to say, oh, when's the doctor coming? I'm so bored. And the value of patience in general, right? This kind of journey that, we're all going on to be kind of our own practicing physicians is a very long one. And patience is incredibly important. And knowing that another 10 minutes is not going to kill you, or another, month of doing something, as long as it's for your love, is not going to kill you. That's what's going to keep you sane, right? Because if you keep thinking too far ahead, if we look through this whole thing, I'm going to give you all panic attacks, right? Maybe some of you are having mini panic attacks. That's not my intention. My intention is to say, look, we all have to realize this is a timeline. One, do you really want to do this? Or is your mom making you be a doctor? Or two, do you want to just make money? What is it? But you got to know that this is your journey, and it's okay that it's this long, and try to enjoy it while it's happening and not just think about the next step all the time. I did that a lot in medical school. Oh, when I'm a resident, I won't worry. Oh, when I'm a resident, I won't worry. It got worse in residency. It was terrible. I should have enjoyed the medical school time. So all I'm saying is, remember to be a human, okay? And remember to learn to be a really good human, because you can bet damn well that I don't want a doctor that just knows medical stuff and has no bedside manner, doesn't know how to talk to me, is not like cool as beans. Tina, thanks for turning on your camera. I saw that. And I don't want them taking care of me because that's just, I don't want that. I want someone who's well-rounded, right? If they're giving me medical advice, right? If you have like a robot giving you medical advice, well, yes, you have cancer, you have 6 months to live. I believe that taking home hospice palliative care is going to be the best option for you, as any chemotherapy is going to kill you quicker, right? Would you rather have kind of that, or someone who really kind of understands, say, listen, I understand your situation. If you want to fight, the odds are low, but we can certainly try with chemotherapy. I'm with you. Or, maybe we want to take a step back and realize that the chances of fighting this are very slim. And I want to make sure you live out the rest of your life with the best and the most quality and with your family at home rather than sick in the hospital every week, right? So you can kind of tell the difference. Obviously, it was an exaggeration, but you can tell the difference in what you're dealing with, right? And you can't just take a few classes and talk like that. It's just not how it works. Even if you robotically learn how to talk like I just talked, it's not going to come off sincerely to someone who's socially aware and socially adept. And you should already just kind of inherently think my patients are going to be more socially adept than me because they didn't go through 16 years of school, right? So you're already behind them in terms of like humanism, right? In terms of like how you interact with somebody, and you have to build that. And that's why I say it's so important to have a life outside of medicine and do more than just be in your books all day, okay? You still got to do that, okay? You still got to do that, but you got to make a really good effort at being learning who you are, learning what you like, and learning what makes you happy, because ultimately you're not going to get through without doing that. If you're a robot, you can, right? If I sever your corpus callosum, then we can talk about it. But I don't do that procedure anymore. I got sued too many times. That's a joke. So another thing on that note, with positive mental health, Tina and Michelle like never laugh at my jokes. It's like only Tracy. I think it's pity laughs. And the rest of the people still have their cameras off. And I swear you guys are killing me right now because I can't tell if you're laughing at my jokes. I can't tell you if Abigail. Oh, we got someone. All right. I want everyone to turn on their screens. You're going to be famous, guys, when they post this to YouTube. Everyone, come on. Vika. No? Come on. You see how we're all smiling now? This is important. There you go, Vika. All right. Chant for Kelly now. Kelly. There's a lot of pressure, huh? Kelly. Come on. Oh,
My camera doesn't work.
Oh, her camera doesn't work. Oh, how could be? Tracy's like, no way. That's not true. All right. Okay. Marissa, Prableen, and Bethlehem will give you 3 minutes to tune in before I call you out individually. So I recommend you do it on your own. It's going to be great. You see how much fun we're having? We're all smiling. Our hearts are all beating a little bit more. This is important. This is human interaction, right? You don't want to come into a cancer diagnosis to a robot, okay? That's just not what you want to do. Being a doctor is so much more. I bet you guys, anytime you walked in to see a doctor, you're like, whoa, a doctor. Oh my gosh. And we're just humans too, but you have to realize that people are inherently trust and love you and like respect you and are just like dropping all of their boundaries to come and see you. So don't just, waste that or take advantage of someone's trust like that. You got to be the best person you can be. All right, I'm done with my speech. Do you guys have more questions? All right, Prableen, good job. I'm really proud of you, if I'm saying that right. Marissa and Bethlehem, come on. Kelly, find a working camera. What else? Do we have any more questions? I have like slides that I can do for like a big presentation, but it's kind of like a long one. And it's like, maybe I'll do it another time. But for this one, it's probably too long. What else? Any more questions you specifically have, guys? Who cares about the YouTube viewers? They're great. We love them. But you guys are here. You guys are all clearly on the medical school path. So ask me a freaking question if you have a question, because who has access to like any questions ever? And I'm going to be honest with you. Do I have any reason to give you that I've not been honest today? All right. It looked like someone was about to ask a question. Oh, Tracy. Okay, Tracy.
Me again. Sorry. Like as like you're like a person of color, right?
A person of color? No.
Yeah. As a person
I'm
of
Jewish.
color,
I'm Jewish.
That has affected you like in med school. Like, have you had any like discrimination or I don't know, with like other doctors or anything, I guess?
I'm sure it exists. And we all have our implicit biases and we all have to work through them. But I have to say that within the field of medicine, I haven't seen it so obviously, but I'm very positive it does exist. And you can bet that there is a lot of bleeping a-hole attendings that are just jerks. And they're going to be assholes to, jerks to everyone. And they're going to be jerks maybe to the people who they, racially don't like. And it sucks and it's terrible. And you don't want that to happen. But the way to respond to that, and I've been doing about that a lot on my page right now when I'm talking about the Palestinian conflict and trying to talk about peace using my page. There's a lot of controversy with race and ethnicity, and it's a very touchy subject, always. And I am afraid that it's going to be that way for some time in the future. And the way that you deal with that is, rather than if someone comes at you, you kind of come back at them with some like a defensive maneuver. Just take a step back, take a breath, and give them some compassion, because that'll really throw them off their guard. I mean, that will really show them you have nothing. You're not out for them. They'll let their guards down, and you can maybe talk to them and see where their kind of biases or where their feelings are coming from and address them, right? But as a Jew, I don't know. I'm sure there have been some times that I've experienced it, and I'm forgetting them now. But ultimately, I'm very outspoken, and if someone were to do that, I'm gonna like address it right there. I'm very confrontational when it comes to that. I'm the most positive person you'll meet, but if you do something that I think is inappropriate to myself or anyone around me, I'm gonna speak up and say something. And I hope that the same is for all of you guys as well. A lot of you don't have your cameras on, and that's okay if you're shy. But at some point, you have to turn those cameras on, right? This is a very low stakes environment, right? I'm not grading you. I'm not gonna like de-admit you from getting into a medical school. But at some point you have to say, I'm committing myself to doing this right now. I'm committing myself to doing medical marvels, and I'm gonna be here right now. And everything you do, you should be 100% in it. You shouldn't be 50% in it. Because one, it reflects on you. Everyone else sees you less positively. And two, you're going to feel less involved in it. And it's not going to be as a positive, rewarding experience for you, right? I have to put myself in the medicine even when I'm off, because that just like gets me in the zone. I'm always in the zone and ready to do medicine, right? I've been on flights where people have like passed out and I have to like work. And I was able to respond to it because I'm always in the medicine mode, right? I'm doing questions, I'm thinking about it, I'm talking to people. So you guys are not in medical school yet, but you guys are doing things to get there. That's part of your path, but part of your journey is existing right now and doing the things you're doing right now. So be 100% in doing what you're doing right now. And I forgive you guys for not turning on your cameras, but I really encourage you to think about what I'm telling you, because I want the best for all of you. If you want to be a doctor, I say you have the right to be a doctor, okay? But it's not up to me for you to get through med school, get through residency, get through fellowship, and be that doctor. That's going to be up to you. And a lot of that's just going to be coming from putting in your all and giving your best into what you're doing every day. Because you better bet your patients are going to want you to give 110%, not like 97, like 110. Okay, more questions. What else, guys?
I have a quick question. So I know in medical school, you have to obviously memorize a lot of stuff and study a lot. So do you have any effective study methods you like recommend we try or something? Yeah.
That's a really good question. I recommend, as I said before, for every class, you should have one textbook and a question bank. That should be your like go-to for everything, okay? And this is a big question bank. It's not like 10 questions. This is like hundreds of questions for whatever class you're in, or 100 questions. Because one, questions reuse the same stuff or reword it all the time. And two, from year to year, the data doesn't change so much that your tests and what you're learning is going to be changing that drastically. When you open up that textbook for the first time, you're going to read through it once, and you're just going to highlight or read through whatever chapters they tell you and just highlight what you don't know. So for some of you, that might be everything. For some of you, that might be a few lines. You don't have to highlight the, and, but. Highlight the little things that make sense. There could be a whole paragraph talking about the cell membrane, but you kind of know by reading it, I really know this much about the cell membrane. I really don't only know this chunk, so I'm going to highlight that. Then you finish the book. You'll do some questions, and you'll go back the week before you'll test, you'll start studying, and you're just going to be going over the highlighted things. That's it. Do not read anything else in that book because you've already looked at it. And if you're going back and you're reading it again, like, what are you doing? You already read that. You understand that, or you realize that that wasn't important. So why are you going to waste your time going over it when you could be reading important things to put in your brain, or to do more questions? So for any class, that's what I recommend. And I recommend, this is huge, and a lot of you are going to go, yeah, right, everyone says that, but it's literally everything. It's planning, scheduling. Google Calendar, iCalendar, whatever it is. Every hour of every day within, from 8 a.m. to 8 p.m. should be blocked off and said, from these hours to these hours, I'm doing this. From these hours to these hours, I'm doing this. And your whole week, 1 week in advance, 2 weeks in advance should be planned off to make sure you're studying correctly. All of us will run into somebody, we'll do this, we'll do that. And that will basically shift your block down. So from 6 to 8, you might have had a fun block. Well, the 12 to 1 or 12 to 2 just became your fun block, and 6 to 8 o'clock tonight, you're going to be doing what you had planned to study that day. That means you got done what you wanted to get done that day, even though these things came up, right? And now that's not always going to work perfectly, but if you keep that in mind of what you want to get done, I want to read chapters 1, 2, and 3 this day, and you make sure you do it. If that means staying a few minutes late, you do it. And you can take a breath, say, I did something. Now I can go out with my friends, go get some boba, go get some popcorn chicken, whatever you do, and enjoy it. And that's it. And you don't have to think about it. And the next day you go back, and you don't have to think about, oh, whoa, I have all this stuff to do. What am I going to do? It's done. It's in your planner because you sat down one day for an hour, half hour, 15 minutes, and said, this is how I'm blocking out my week. And this is what I'm going to be doing this week. Okay, does that make sense? Planning, limited resources, question bank. That's it. That's all you really need. People are out here with like 15 books and like, yeah, I'm gonna get an A. Like, oh, you're working really hard for that A, dude. And there's a lot of information in what you're doing. How are you gonna decipher what's important, right? There's no way he can do the highlight method with that. Mnemonics are really good. And PicMonics, if you guys have heard of it, are really good as well. So if you're learning about a certain enzyme, there's usually, check out picmonic.com, okay? And you'll see what I'm talking about. And you're gonna say, that's weird. I don't know if that's gonna work for me. And I said the same thing, and it's like, life changer. Oh, Vika left. All right, anything else, guys? Kelly, Marisa, Bethlehem. Marisa, Bethlehem. Come on, guys, you can do it. Come on. Probably Lean's looking. She's like, come on, just do it. Just go. Abigail's texting. We lost her. Any other questions, guys? What else?
I don't have any more questions, but I kind of just want to thank you because I feel like I've been in these Zoom meetings before, like with Medical Marvels, and I feel like your perspective has been like different from a lot of other people's, to where like you can make mistakes, you should live your life, you should have fun. So I'm very thankful for that. That kind of put me at ease a little bit.
No, of course. And you can make mistakes, but you got to work hard still. That doesn't mean you can't work hard. And you have to be open to alternate options. So DO schools and IMG schools. A lot of these people are coming from the realm of only US. Well, that's the only way to get it. It's not. There's like so many opportunities in different pathways. If you're just willing to work hard and not like live at home with mom and go to the local medical school, then you're going to be fine. If you want to be a doctor, you can be a doctor. And if that doesn't work, you can be a PA, you can be an NP, whatever it is, a tech, whatever it is. There's always little trickle-down options that you'll still be happy doing. But you just have to be open. Just be open-minded and be positive. And get those life experiences in, because if you get to some life experiences and you realize, oh man, I don't really like medicine, you get out now and you can like enjoy your life and like do economics or something easy. You know what I'm saying? No offense to the economics majors. It's actually not easy. I hate math. I don't know why I said economics. Psych, I'll say psych. Psych's a little bit easier. Any more questions, guys? I'm really proud of you guys for turning on your cameras. It's really big moves. It's really fun. And the viewers are going to see it. They're going to love it. It's going to be great.
So I have a quick question. So you mentioned earlier that when you don't know how to treat a patient, you ask, like, you search up stuff, or you ask someone to search it up for you. So how do you like search up what do you search up and how do you search it up? Like,
all right, so let's say I have a patient with pneumonia and they've been hanging out on some like oral antibiotics. Okay, the doctor heard some crackles when he listened to them with the stethoscope about a week ago, and they've been getting worse. Their cough's been getting worse. They get more sputum. They're having trouble breathing, so they're coming into the hospital. Now we have to decide, okay, what's the next step? What's the next level antibiotic? There are algorithms for all of this. There's algorithms and there's recommendations on websites to address all of this. Like Up to Date is one. Like I said, AAFP is a really good one as well, like I showed you. LexiComp is for drug dosing and indications. There's a lot of different online resources and you'll learn them. And there's not that many. It's not like some crazy answer. But ultimately, you should memorize these things because in emergencies, you know, it's good to know what emergency drugs you need, right? If someone's throwing themselves into an arrhythmia and they're passing out, I don't have much time to go online and look up what the drug for arrhythmia is. I should know they're in atrial fibrillation, they need rate control. I'm going to give them 5 milligrams of metoprolol right now, right? But there are things that you can look. And, you know, in medical school and residency, you're learning. When you're a new attending, when you graduate, you're learning. When you're a fellow, you're learning. So you're allowed to make mistakes. And that's why I say at any point in your life, you're allowed to make mistakes. Just don't make the same mistake because then you're not learning. And I can see that you're not making the effort, right? Does that answer your question? Anything else, guys? I'm here for you. No? That's okay. You guys asked a lot of questions. I wish you guys all the best of luck, okay? Find me, all of you, and whoever watches Jeremy Grossman _ anytime, whether you want to ask me a question today, whether you want to ask a question tomorrow, in 2 years, I'm going to answer questions because this is like what I've decided I'm going to do with my life, and I do it for free. I'm not going to charge. Reach out to me. I answer questions. I get bored a lot too. So it toots my horn when you message me. I go, oh, they think I'm important. Let me respond to their question, right? So it's selfish too. Okay?
Yeah, I just want to say thank you so much for coming. I really, really enjoyed your talk, and your like positive outlook on life is so like inspirational. I hope that I can have the same view on life as I grow older. And like hopefully I can accomplish my goals because without with good mental health. So yeah, thank you so much.
You totally will. Good luck to all of you, okay? Follow your dreams, reach out. Best of luck, and just stay positive. Just like be a human, okay? Just don't forget. If there's one thing you take away from today, just like remember to be a human and stop putting so much pressure on yourself. It's driving me crazy how much pressure you're putting on yourselves, okay? Bye, guys. Take care.
Thank you.